Top 15 ICU medicines list. 1. Noradrenaline, norepinephrine. Use. Septic shock, hypotension. Dose. Start 0.05–0.1 micrograms per kilogram per minute IV infusion. Right pointing arrow. Titrate to maintain MAP is greater than or equal to 65 mm of mercury. 2. Dopamine. Use. Cardiogenic shock, bradycardia. When atropine fails. Dose. 2 to 20 microgram per kilogram per minute IV infusion. Low-dose renal perfusion. Use no longer recommended. 3. Dobutamine. Use. Acute heart failure. Cardiogenic shock, low output state. Dose. 2 to 20 microgram per kilogram per minute IV infusion. 4. Adrenaline, epinephrine. Use. Cardiac arrest, anaphylaxis, refractory shock. Dose. Arrest. 1 mg IV every 3 to 5 minute. Infusion. 0.05–0.5 micrograms per kilogram per minute. 5. Vasopressin. Use. Septic shock, adjunct to noradrenaline, GI variceal bleeding. Dose. 0.01–0.04 units per minute IV infusion. 6. Amiodarone. Use. Ventricular tachycardia, atrial fibrillation, flutter. Dose. 150 mg IV over 10 minutes, then infusion. 1 mg per minute times 6H. Right pointing arrow. 0.5 mg per minute. 7. Atropine. Use. Symptomatic bradycardia. Dose. 0.5 mg IV every 3 to 5 minute. Max 3 mg. 8. Midazolam. Use. Sedation for ventilation, seizures, procedures. Dose. 0.02–0.1 mg per kilogram HIV infusion, bolus 1 to 2 mg IV. 9. Propofol. Use. Sedation in ventilated patients, induction agent. Dose. 5 to 50 microgram per kilogram per minute IV infusion. Avoid prolonged high-dose use. Right pointing arrow. Propofol infusion syndrome. 10. Fentanyl. Use. Analgesia, sedation adjunct in ICU. Dose. 25–100 micrograms IV bolus. Infusion 25 to 200 microgram per hour. 11. Morphine. Use. Pain management, preload reduction in pulmonary edema. Dose. 2 to 5 mg IV bolus, repeat PRN. 12. Cisatracurium, atracurium. Use. Neuromuscular blockade. For ventilation, ARDS. Dose. Cisatracurium 0.15–0.2 mg per kilogram IV. Bolus. Right pointing arrow. Infusion 1 to 3 microgram per kilogram per minute. 13. Hydrocortisone. Use. Septic shock refractory to fluids and vasopressors, adrenal insufficiency. Dose. 50 mg IV every 6 to 8 H or infusion 200 mg per day. 14. Insulin, regular. Use. ICU hyperglycemia management. Dose. Continuous infusion, titrate. To target glucose 140 to 180 mg per deciliter. 15. Furosemide. Use. Pulmonary edema, fluid overload. Acute kidney injury with volume overload. Dose. 20 to 80 mg IV bolus, may repeat. Or use infusion.